She described it as a fried egg, and the tumor is the yolk, and they are ultimately trying to remove the yolk, but they also remove a perimeter, a margin around the yolk of clean, cancer-free tissue, and that's how they know they get it all. And so when you get a lumpectomy, the results come back, and they want to make sure that that margin of tissue, the white of the yolk, has no cancer in it. One of my other options was to have a mastectomy, and I was still hopeful for the least intervention. I didn't want to remove my breast, and some women choose that. It's the right choice for them. Maybe they got the genetic testing back and they had the BRCA gene and they're really high risk. Just like walking on eggshells. Fear of the unknown, like you don't know what it's going to come back with. And again, my pathology came back with cancer in it, and yeah, that was probably, if I think about the lowest points of this whole process, getting those results was probably one of the hardest moments. I asked her, if this was your breast, what would you choose? And I also asked her, if this was your daughter, what would you advise? And she very honestly, without hesitation, said, I would get a mastectomy. And so that's what we decided. But at that point, so this was the end of March. I was diagnosed in January. And she said, and because it's been 3 months since your diagnosis, we want you to do chemotherapy first. And so a couple weeks later, I went in and got a port installed in my chest, like a little teeny plastic device, not teeny, it's about the size of a Hershey Kiss, with a hose that went under my clavicle, up and straight into my heart. And that was creepy and weird. And that set me up for getting my chemo infusions. And so I, after a lot of back and forth with the oncologist, we decided on what's called CMF chemotherapy. I think the most painful part of the first procedure, the lumpectomy and the removal of the lymph nodes, was the incision in my armpit. And after that, I had scar tissue in my armpit, because they go in there and they don't cut any nerves, but they move stuff around, and then they removed 6 lymph nodes. And that caused a lot of scar tissue. And afterward, when I would reach my hand, it took me a couple weeks to be able to do this, but when I would reach my hand all the way up over my head, I would feel this intense pulling all the way to my wrist. And I learned that from my physical therapist that that's called cording. And eventually the cording went away and the pain went away. I'm still a little tight on this side. Yeah, I'm trying to think. That was probably the most painful.